I'm so glad we were able to finally get the kids together for a play date. Finally, it's been so long.
It really has been. So how's everyone been doing?
Life's been pretty good, pretty busy. Last week Johnny was sick, so we took him to the clinic.
Oh, that's no fun. Who did you go to see?
We went to a new nurse practitioner, and she was absolutely wonderful. She really took the time to get a good history, and I really liked her a lot.
Why didn't you just go see a doctor? You know, they have more years of schooling, so they probably know more.
Well, we live pretty far from the city, and doctors are never really available out there. Anyways, nursing is the most trusted profession, and nurse practitioners require a bachelor's degree and master's degree at a minimum to be able to practice.
Yeah, I don't think that point here is like doctors versus nurse practitioners. I mean, they both manage the same conditions and are able to reach a larger group of people.
And the MP can even write prescriptions to take care of Johnny's ear infection.
Well, I'm just not so sure. I would need more information before I would trust my kids' care to a nurse practitioner. I just want the best for them.
Hey, sorry I'm late. I was just wrapping up with a patient. Being a nurse practitioner is a lot of work.
I was just telling them how I brought Johnny to the MP last week. She was so smart and took the time to explain what was going on so well. The nurse practitioner also convinced us both to get our flu shots.
But aren't you afraid of catching the autism?
Well, actually, the MP explained that you cannot actually get autism from the flu vaccine, or any vaccine for that matter.
Yeah, I know for sure that vaccines don't give you autism, but isn't it a little irresponsible to let Johnny get the vaccine while he's sick?
Well, actually, that's a misconception. A cold or an ear infection wouldn't be a reason to not get a vaccine. Your body would still respond the same to the vaccine, and it wouldn't make the sickness any worse.
So let me get this straight. What exactly does a pediatric MP do?
We do a lot of things, but most of all, we keep our community healthy. Depending on where you work, you might see different things, but we all see patients from birth to 21 years old. We do well checks, prevent disease, diagnose and treat conditions, manage long-term conditions, and screen for development. We can even provide prescriptions to help manage diseases.
They're also really great at supporting patients and families and guiding them through all the stages of life that your child goes through.
But that sounds so similar to what a doctor does.
Well, we play a very similar role. They've actually done research that shows nurse practitioner outcomes and doctor outcomes are pretty equal. NPs also lower healthcare costs, provide access to care for more people, and even have higher patient satisfaction scores.
Wow, that's great. So what exactly made you become a pediatric primary care nurse practitioner?
Well, as a child, I really loved my pediatric nurse practitioner. She was able to really take the time to get to know me and my life, and that really showed in her care. And I wanted to be able to make that difference in my patient's care too.
Okay, I think you've convinced me. I'll take my kids to see a pediatric nurse practitioner.